Hello, my name is Jason Geiler with Cyber Risk Management, and I'm here to discuss HIPAA security audits and is your organization prepared? So thank you very much for coming and sharing 20-25 minutes with me today to learn about HIPAA security audits and all the changes that have happened within HIPAA. So key takeaways for today are recent changes to HIPAA, the HITECH Act and the Omnibus Rule, as well as HIPAA Phase 2 security audits. Specifically, we're going to talk about the business associates as well as covered entities. We're also going to talk about ransomware and HIPAA and the part ransomware plays in the HIPAA guidelines. We're going to talk about current threats and then who is cyber risk management to close out the webinar. So to start, the HIPAA privacy rule. If I could ask a show of hands for anybody who's listening, how many of you are pretty familiar with the privacy rule? Yeah, that's what I thought. Most people are. This is for anyone who's not, this is the original information that was put in place, original guidance that was put in place that healthcare organizations need to follow to protect patient information. And this can be in a variety of different ways. But I know most of you are saying, okay, Jason, we know the privacy rule. We're kind of here to learn some other things. So what is HIPAA? HIPAA is the Health Insurance Portability and Accountability Act. This provides a framework for establishment of a nationwide protection of patient confidentiality, security of electronic systems, and standards and requirements for electronic transmission of health information. So HIPAA was originally enacted back in 1996. The privacy rule was updated in 2000. In 2003, the security rule came into play, and the security rule is what we'll talk about today, but that is in addition to monitoring conversations and computer screens, but what do you do when you've collected that information to keep it safe? Then the changes started happening pretty rapidly. So in 2010 and 2013, we had the HITECH Act and the Omnibus Rule come into play. And those two really changed the way HIPAA needs to be managed. And what happened then is in 2012, HIPAA did a compliance audit program. They did 300 audits just to see how well the HITECH and Omnibus Act changes were helping to protect information. What they learned was compliance with the Omnibus and HITECH changes was very poor. So with that, they were able to, the Office of Civil Rights, who manages HIPAA, was able to request and receive additional funding in 2016 to do a Phase 2 compliance audits. And that's where a lot more audits were done than just the original 300. And with that, they were really looking to see what advancements were made in protection of patient data, EPHI. So the question I often ask is, do you understand all of HIPAA? So after 20 years, we've heard about the privacy rule. A lot of people feel pretty confident there. The security rule, you've probably heard something about it. You've talked to your IT staff or maybe your IT partner. They assure you that things are covered. You even hear things like, oh, this product you purchased, it's HIPAA compliant. Your EMR system, your medical record system, it's compliant. We do an annual risk assessment on it, so you're good. But you hear that, but you still have some questions whether you're truly compliant with the rule. And you know non-compliance has consequences, but you're not really sure what these consequences are. And if you're in that boat, then the next 20 minutes will be very informative to you. So there are 4 pillars of HIPAA governance. There's the privacy rule, and the privacy rule has been around for quite some time, just as we've discussed. You also have the security rule, and the security rule is a little newer, but even in its newness, it's still been around for a little while. Then you have the breach notification rule and the enforcement rule. And these both were part of the HITECH Act that we talked about a little earlier. And what they do is the breach notification rule specifically says what it's very prescriptive in what a healthcare organization or a business associate has to do in the case that there is a breach. And the enforcement rule, similarly, is very prescriptive in what needs to happen after a breach occurs. But if you don't have the last three, the new pieces, security, breach notification, and enforcement rule in place, then your security crumbles. So what I want to do is make sure that your organization is not in a position where your security system is going to crumble. So to talk a little bit about the Omnibus Rule and the HITECH Act. So the HITECH Act came in and initiated the enforcement rule as well as the breach notification rule. The HIPAA security rule, as was updated through the Omnibus Act, really establishes protection for electronic PHI, which is protected health information. You'll often hear that referred to as EPHI. And what it does is it allows covered entities and business associates. So a covered entity is a healthcare organization that has protected health information. A business associate is an organization that has access to that information even though they're not a covered entity. So they're not a healthcare organization, but they still have access to that information. And they must implement administrative, technical, and physical safeguards that appropriately protect the confidentiality, integrity, and availability of electronic protected health information. They also have to protect against reasonably anticipated threats or hazards. They need to protect against any anticipated uses or disclosure of EPHI that are not permitted under the privacy rule, and ensure compliance with security by its workforce. So you're responsible for your employees when it comes to protecting health information. So the HIPAA Phase 2 audit program. So this began in 2016, and it came in place as a continued effort to comply with HIPAA privacy rule, security rule, breach notification rule. So it began in 2016. It includes covered entities and business associates. It's mostly desk audits with some site audits, and communication has gone out by email already. So if you have not seen anything in regards to your HIPAA Phase 2 audits, you need to look through your spam. So the Office of Health and Human Services, HHS, recommends checking your spam folder. Now, OCR, the Office of Civil Rights, who reports to HHS, is doing the audits. And through this, they are given everything they need to be able to make the audits. So OCR will enhance industry awareness of compliance obligations and enable OCR to better target technical assistance regarding problems identified through these audits. One last thing about the audit program is a list of businesses, a database of business associates is being created. So all the business associates that you do business with should be included in that, and they are also eligible for audits. So I briefly talked about administrative, technical, and physical safeguards. And if your organization is not diligent, doing your due diligence on all three of those areas, you will be found guilty of willful neglect. So I will get into more detail on that momentarily, but let me tell you about some companies who were found guilty of willful neglect or who did not put their due diligence into the safeguards on the previous slide. So there were 300 breaches reported in 2016, and there have been over $10 million issued in fines by the OCR. So Lincare, a home health provider, Lincare had a pretty strong program in place to protect their data in a security area. So much so that they had a policy that all your files that are kept on your computer must also be kept in paper file. Well, one of their salespeople was going through a very ugly divorce. And through this divorce, they kept their information in the trunk of the car. Well, through this nasty divorce, the husband ended up getting the car that had the information in it. And he became a whistleblower, so he went to the Office of Civil Rights website, put in that he knew of a breach and told the details of it because he still had those files. And Lincare was audited and fined $240,000 because those records are left in the car. So you have to have strong procedures in place so that incidents like that don't happen. Another one is Athens Orthopedic. So there were 20,000 records lost in a breach, and this breach wasn't even through Athens Orthopedic. The breach actually was through one of their vendors. But because they had a weak vendor management program and did not vet their vendors, because of that breach, they were still they're still going to have to go through an audit. Hollywood Presbyterian Medical Center. Now this one just happened right before Christmas, but Hollywood Presbyterian paid $17,000 in Bitcoin. If you don't know what Bitcoin is the currency of choice among cyber criminals because it's very hard to trace and very liquid. And the hackers seized control of the entire Hollywood Presbyterian computer system. So much so, Hollywood Presbyterian had to go back to doing everything via paper files for a week. And then Raleigh Orthopedic, this was a few years ago. They've already had the fine issued by the Office of Civil Rights, but they did not have a business associate agreement in place with their medical records vendor. And because of the lack of agreement, they were fined $750,000. This is not a really big group. There are either 10 or 12, my memory doesn't serve, doctors in that practice, and they were fined $750,000. So the fines that are coming out through these HIPAA audits are substantial, and they're really trying to teach some lessons that you need to have your pieces in place and have your due diligence and not be found guilty of willful neglect. So what triggers an audit? Audits can be triggered in three ways. So the first one is you've got a random audit through the program. Those happen. If they do, they're going to come in and look at your systems, and you need to make sure that you have your documentation in place. Number two, if subject to a data breach. So if you do have a data breach, if you're one of those unfortunate institutions we talked about on the previous page, you have to notify the Office of Civil Rights after a breach, and usually that breach is going to be the cause of an audit. And ransomware is now being considered a breach by the Office of Civil Rights. Also, if anyone, patient, staff member, ex-husband files an incident on the OCR website, you can be audited. So what are the current cybersecurity threats that are causing all these problems? Well, the first one is ransomware. And just as I said, just as on the previous slide, ransomware now is considered a breach under the guidelines of HIPAA. It was a little ambiguous before 2016, but the Office of Civil Rights came out and made it very clear that ransomware is a breach, or likely represents a breach. There are a few instances in where it's not, but almost always it is. But what ransomware is it encrypts your data and demands a ransom payment to release your data. There were 4,000 ransomware attacks a day in 2016, and that's a 300% increase over 2015. It has quickly become the tool of choice for cyber criminals. There's no guarantee you'll get your information restored if you pay the ransom. That's another big fear, and James Comey, the director of the FBI, has actually put his guidance that he would like you to not pay the ransom, but it's still done in many cases, and as you saw, Hollywood Presbyterian did make the choice to pay. There's evolving malware threat. So ransomware is a type of malware, but there are 1 billion pieces of malware produced every day. And so everybody has their firewalls and their antivirus. With 1 million new pieces being developed every single day, the chances of your firewall and antivirus being able to stop all the new strains is nearly impossible. There are 10 million cyber attacks per day as of 2012. This is per the U.S. Department of Defense. It's the latest information we have. As we've seen exponential growth in the number of attacks, I'm sure that number now is exponentially high. There are even black market websites to provide quality testing for your malware. So if you want to make a new malware code, there's actually quality assurance for that. I want to address man-in-the-middle attacks real quickly. For less than $100, someone can purchase a device and go to a public space and set up an imitation router. And anyone who joins the imitation router will be sent, all their information will be going through a bad guy's computer, and they will have access to all the information you put in. If you check any work records, if you check your banking records, anything else, they have access to what website you're going to, what information you're entering, everything you're doing. Phishing is one that's become real popular as of late. And this is where emails are sent that are very real looking, and they're sent to businesses to try to get people to click on them. They're usually done for financial reasons, but oftentimes they are loaded with a ransomware or a malware payload that by clicking on something, you're allowing the payload of ransomware, malware, whatever it might be, through clicking the email or clicking a link to get into your system. And there's really your antivirus has no chance of stopping all of those. And social engineering is a new one that's come up. And this is where if someone has picked you as a target, that they can go out to your social profile, your entire online profile, and learn a lot about you. And by learning that, they set forth a path that they specifically try to target either you or your organization to gain access, using all the knowledge and using everything they've learned about your persona. So taking a step back, we've talked a little bit about the HIPAA security rule, but what does it include? What things do you need to do to have a compliant system? Well, the first is technical safeguards. Most of us are familiar with those, firewalls, antivirus systems, but it's even things like screensavers, device ID scan badges before you get into your systems, assignment of access, so make sure that employees only have access to the files that are necessary, and this goes all the way up through the CEO. Physical safeguards, you have physical barriers in place that reduce the opportunity for bad guys to get information. So do you secure doors? Do you have monitoring systems on your facility? Do you secure unattended computers? There's a lot of cases where there are really, really old computers that have like one use once a month and they're still on a network. And because they're so old, they're just full of vulnerabilities. That's an easy way for a criminal to get into a system. Now, I want to spend a minute or two on administrative safeguards because they are so important. And administrative safeguards are also often the most overlooked. But the Office of Civil Rights and the HIPAA vehicle require that companies follow these administrative safeguards. So an annual risk analysis. So on an annual basis, you are looking at what your risks are and putting in place a mitigation plan. That is so important. Security management process. You need assigned security responsibility, making sure one person is responsible for security in your organization. Workforce security, information access management plan, security awareness and training, security incident procedures. What happens if you are breached? What is your plan? What do you do to make sure that the damage is the least it can possibly be. What is your contingency plan? Do you have business associate contracts and other arrangements in place? And do you have a vendor management program in place? Because business associates, covered entities, are responsible for making sure that their vendors, their business associates, are putting forth due diligence into their systems also. So what is a breach? Well, the definition of a breach is an impermissible use or disclosure of unsecured PHI is assumed to be a breach unless the covered entity or business associate demonstrates a low probability that the PHI has been compromised based on a risk assessment. So an example of this is we had a client, and this client had a laptop with a large amount of ePHI on it, and someone broke into their car and stole their laptop. So in most cases you would think, oh my gosh, that's a data breach, they're going to be audited, etc. But because that computer was crypted, the encryption gave a low probability that the PHI was compromised because they wouldn't have the encryption key and they wouldn't be able to get into the laptop. So that made it a low probability, and because of that, because our organization had installed the encryption on that laptop, even though they lost the laptop, we did not have to submit that as a breach. We were able to document it, that it happened, but it was not a breach. So what happens after a breach? Well, the entity must promptly notify the OCR if there's any breach of unsecured PHI. And then if it's over 500 records, they have to notify the media. So then the media can tell its constituents that there was a breach and tell the level of the breach. And that is not a good thing for business. So the HIPAA breach notification rule has also stated through the Office of Health and Human Services that ransomware is a breach in most cases and must be treated as a breach. So with ransomware, as prolific as it is in today's society, that is a really big risk that is now clearly a breach in terms of HIPAA. So the HIPAA enforcement rule, a little bit about this, is the federal government through the Office of Civil Rights protects PHI using the vehicle of HIPAA regulations. So civil penalties can be up to $1,500 a year for identical types of violations. So that means that a company can be fined $1.5 million for HIPAA violations. Willful neglect violations have a mandatory fine that's associated with them. Now, they're not always $1.5 million, but as we found, the Office of Civil Rights is handing out substantial fines. In addition, there are criminal penalties for anybody who was involved in the willful neglect claim. So if you're an office manager or a physician, there are criminal penalties that can associate a breach if your organization was found in willful neglect and not putting the due diligence in, not putting the time, effort, and resources behind a HIPAA compliant system. So business associates, we've talked about these a couple times, but I want to really share the definition, is any companies that maintain PHI on behalf of a covered entity. These could be data storage, medical billing, there's a whole host of other companies. And they are responsible for following the guidelines of HIPAA. So business associates have to follow all four pillars. They must have an agreement in place with each covered entity they do business with, and it must be signed after the Omnibus Act went in place in 2010. So if you have in your possession business associate agreements that are older than 2010 or even from 2010, make sure you check those, because if they are older, then they need to be redone because of the changes that have been made since the Omnibus Act. Covered entities are responsible for a reasonable level of due diligence to ensure their business associates have an effective compliance program in place, the administrative, technical, and physical safeguards. And the 2016 Phase 2 audits are building a database of business associates that will be eligible for audits in 2016. So there is a database out there of business associates, and they are able to be audited just like a covered entity is. So business associates agreements, if you're a covered entity, and if you don't have a business associate agreement assigned with any of the vendors listed on this page, that's something you should think about. And if your company happens to be one of these companies that's on this page, you should probably contact your covered entity and tell them they need to have an agreement in place with you for a business associates agreement. So I want to take a minute and talk about cyber risk management and who we are. Cyber risk management is a full-service security firm. We do cybersecurity as our specialty, but specifically we do compliance. And HIPAA compliance is one of the top areas of focus for cyber risk management. We have 3 decades of IT consulting experience, and we have 4 years of specifically focusing on compliance with different regulations. And those include HIPAA, FFIEC, FTC, GLBA, SEC, PCI, and a variety of others. We offer a variety of professional services. We can help you with your overall risk analysis, so we can help you understand what your risks are, put together a mitigation plan. All of the policy and procedure work that's needed for HIPAA compliance, we can do all of that for you. Security awareness training is a specialty of ours. E-phishing, social engineering testing, we can do all of that. Business associate oversight, we can help you put together a vendor management plan. And we can even go to the level where we'll do a HIPAA risk management program, and we will manage all of your HIPAA compliance needs. In addition to knowing that we do these services, cyber risk management focuses on small to medium-sized businesses. So a lot of times we find small practices, 1 or 2 doctors, maybe even up to 10 doctors, who feel, well, we're so small, we don't really need to follow these guidelines, which is not the truth. You do have to follow the guidelines. And we have a plan in place that will be able to economically give you the tools you need to be compliant. We also help companies all the way up to regional medical centers. Very happy to help regional hospitals and medical centers with their HIPAA compliant needs. And some organizations that already have a HIPAA compliance team in place, we do a lot of third-party risk assessments so that you can have an outside firm coming in and giving you some a different set of eyes and another look at your systems. And we can also handle your vendor management and business associate oversight for the larger organizations. So I'll leave you here with my name, Jason Geiler, my email address, which is on the slide. And if you have any questions, would like to have a conversation, would like me to just talk to you a little bit about HIPAA security, what's in HIPAA security rule, what's involved, what should your organization be doing, what does it all cost, I'd be more than happy to have those high-level conversations with you. Please contact me. And I'd like to end saying thank you for your attention, and have a great day.